Changing my diet literally saved my life. I'm Brooklyn Borough President Eric Adams. I was diagnosed with type 2 diabetes. I had nerve damage in my leg and my hands and feet. I lost vision in my left eye. I was told I would be on medication for the rest of my life. That is when I researched and learned food was the leading cause of my condition. I changed my diet to a whole food, plant-based diet filled with whole grains, beans, vegetables, fruits, nuts, and seeds. And I reversed my type 2 diabetes. And as we have seen the last few months battling the coronavirus pandemic, health matters, and information is key. That is why I've begun a conversation on health, introducing our Wellness Wednesdays series, featuring doctors from around Brooklyn specializing in general, internal, and emergency medicine, as well as pediatrics. So please come join me and bring your questions. Want to know the best way to access in-person care? When to visit an emergency room and when not? When and how to use telemedicine? When to take your child for routine appointments and vaccinations? And how to do all this during COVID-19. Please take advantage of this opportunity to learn and address your family's health by speaking with a special group of Brooklyn doctors. They are here to listen and inform. And who knows, the information you gain might help save your life or someone you love.
Well, good afternoon, everyone. My name is Lori Lewis. I'm the head of strategic alliances and programs for Brooklyn Borough President Eric Adams. Unfortunately, the Borough President could not join us today, but he sent me some things to say to explain why he wanted to do this program and why we're looking to do this series of wellness events. As many of you know, his diet saved his life. The Borough President is now totally plant-based. He was diagnosed with type 2 diabetes. And he became totally plant-based, eating nothing but whole foods, grains, beans, vegetables, fruits, nuts, seeds. And I can honestly say it has done him well. He has been healthy and strong throughout this entire pandemic. As you've seen, he's been out in the streets. He's out talking to people, giving out PPE. He's been busy. And so he knows how important our health is at this time as well as always, but especially now. And so he wanted to do this series for a couple of reasons. One, we started hearing from our constituents that many of them were afraid to go sit in a doctor's office. You know, they don't know about the social distancing and how is the office set up. So they, they haven't been to a doctor. And then there are others whose doctors are not doing virtual visits, so they couldn't talk to their doctor directly, or they just talked to them on the phone. So we thought this would be an opportunity for some of our constituents. We've e-blasted this out to our regular e-blast list, which is 30,000 people, to let people know here's a resource where today we have 2 doctors. We have 5 next week and 2 the week after. But these are doctors that have advised the Borough President, been advisors to our office. They've worked with us on other programs. We're so happy to have both of you here with us today. And I know Glenda's going to do a little introduction, but we just wanted to thank you all for participating. And I see we're going to have more people joining. So yes, let's go ahead, Glenda.
Great. Thank you, Lori. Good afternoon, everyone. My name is Glenda Silva. I am Development Director at Brooklyn Borough Hall. And I want to thank everyone for attending today's session. And I just want to begin to highlight a few ground rules before we get started. As I said earlier, and as of right now, we are being recorded. So this session will be recorded. Everyone will be muted except for the guest speakers, who will introduce themselves shortly and speak on the impact of COVID as it relates to their specialization. Prior to the session, we received several questions from constituents. The questions will be read by Lori Lewis and Mike Moutal. If you have a question during this session, please submit it in the chat function. Lori and Mike will review the questions and will highlight several of those questions from there as well. The chat will be downloaded and shared after this session. If you feel that your question has not been addressed, then we ask that you please email your question to askeric@brooklynbp.nyc.gov, or you can highlight, again, your question in the chat room, and we can sort that out and try to make sure that it is addressed. And now I would like to introduce you to the guest speakers of today. First, we have Dr. Leslie Hayes. She is from the New York Presbyterian Brooklyn Methodist Hospital. And we have Dr. Noah Kandamudi. He is Chair of Department of Pediatrics at the Brooklyn Hospital Center. Thank you both for leading this discussion. And again, thank you all for attending.
Dr. Hayes, you could go first.
Okay, great. Good afternoon. As Glenda Silva has said, can you all turn my light out for me? Make it brighter right here? Thanks. Sorry, my lighting is a little dark, so I was asking my daughter to turn it up for me. Thank you, Glenda, for introducing us somewhat, but I will tell you, I am Dr. Leslie Hayes. I'm Chief of Adolescent Medicine at the New York Presbyterian Brooklyn Methodist Hospital in the Department of Pediatrics. I want to thank the Brooklyn Borough President's Department for putting together this weekly series. I think that it's a timely and pertinent series to present to the constituents and giving them an opportunity to call in and ask questions related to COVID and I guess related to other health objectives as well. I am an adolescent medicine specialist, and that means that my patients are between the ages of 11 and 21. So some people would consider me a pediatrician who only takes care of teenagers, tweens, and young adults. And I do cherish that title. And my patients present to me with well-visit issues, but also all the issues that relate to being a tween, an adolescent, and a young adult. So oftentimes, not only am I addressing medical-related issues, but I'm addressing what people may more so consider psychosocial issues and how they impact on the development of young people within that age group. So as far as COVID-19 and its impact on adolescents, I can say, other than the multi-system inflammatory syndrome related to children, I have actually been spared the burden of dealing with positive patients who have been symptomatic and needed hospitalization. That doesn't mean I still haven't had the impact of my patients' family members being struck with the illness and the impact of how that illness has burdened their families and how that impacts them in their daily lives. And looking at the social distancing, as well as needing to wear a face mask and self-quarantining, that has been significant for my patients. So thank goodness, not necessarily seeing the morbidity of, or I should say the mortality of COVID in my age group, but seeing the morbidity of COVID in my age group has definitely been something that I've dealt with over these last couple of months. But I'll stop there. And I look forward to answering questions from the audience. Thank you once again for inviting me to be part of this panel this afternoon and having the opportunity to work alongside my esteemed colleague, Dr. Noah Kandamudi.
Good afternoon, everyone. I'm really honored and excited to be part of this conversation here for this very important work that the Borough President has undertaken. And thanks to technology with Zoom, you know, we can do this sitting in your own office, but yet talking to so many people. Little bit about my background. I was born, brought up, raised in India originally, but I moved to the Caribbean at a very young age. I did my pediatric training in Kingston, Jamaica, where from the University of West Indies, and then came over to the US. I worked there actually as a faculty member for a while before coming here, and then I trained here in pediatric emergency medicine at Montefiore. And then I was in charge of the PEDS-ED for a very long time. About 2 years ago, I came here, I left here to go to Rutgers in New Jersey, and then came back here 2 years ago to be the chair of this department. So my experience mainly is, in my life, has been mostly emergency medicine. However, since I'm now the chair, I poke my finger into every corner of the department, which is anything from newborns to pediatric intensive care to the regular floor and so on. We had a few patients with COVID, so I can expand on that depending on the questions we get. And thankfully, as Leslie mentioned, overall, the impact of COVID on children itself is not as humongous as in adults, although in a family situation, there are definite morbidity and concerns and anxieties and so on. With that, I don't know if I took my 3 minutes, but I think I'm ready to have the audience shoot some questions.
Great, thank you, doctors. Given that we do have a manageable crowd of attendees, I'd like to welcome, if anyone feels comfortable, to raise their hand, and we'll call upon your name and open the floor for you to ask your question to these doctors. She's raising her hand in the camera, Tracy. Okay, Tracy?
I want to be wherever Tracy is.
Me too.
Can you unmute her?
I did. However, Tracy, could you unmute yourself? You did?
There I am. There I am.
Okay.
That was in December in Barbados, right before this happened. We were there for 3 weeks. But anywho, my biggest concern, I've been talking to a lot of different parents and organizing and figuring out what we're going to do. And we have to do that very soon. And the concern is I have a 6-year-old. And I don't even like to wear the mask for more than a half an hour or 45 minutes. My concern is sending her back into school to sit with this mask all day for 6 hours. I think it may be a bit torturous, actually, and unreasonable to expect her not to put her hand under the mask or do things that would put her at risk and then further put the household at risk. So I wonder what the feedback is when it comes to, because at this point in time, I've decided basically remote, because that's the only way I can manage her environment. So I wonder what your feedback is on her, especially such a young child, sitting with something like that all day.
You want to go first, Leslie? Ladies?
Actually, I'm going to let you go first because it's more general peds. I like the teenage question.
Well, let's talk about why do we even have to wear masks? Actually, you make a good point. I don't know of any adult that sits in a mask for 6 hours, right? In fact, everybody is pretty quick to look for an opportunity to take it out. First of all, the masks are absolutely recommended, mainly because the COVID virus spreads through droplets, right? And it's and the percentage of the probability of spreading to someone is drastically reduced if you have a mask, and if both people that are in conversation or in vicinity wearing masks, it's really makes a huge difference. Having said that, the masks are not comfortable, so the schools are, the recommendations are you should wear a mask, but also appropriate social distancing, right? And there are times when you have to give mask breaks, so to speak, right? Certainly you can't eat with a mask, right? So most feeding times you don't have a mask. And then if you're away from someone, particularly in an outdoor setting, you probably can get a mask break like that. And that is something being recommended, like why don't kids go out of the classroom into, at least while the summer is still here, and maybe, have some distancing when they're eating food and so on. The other thing, I haven't read this, but intuitively I'm thinking like if they can make like these face shields, they probably are going to be a little more easier to deal with, the ones with a little glass, but I haven't seen many for young children. They're okay for young teenagers and adults, but for the little ones, it's a little more difficult. And I guess you do need to find an appropriate, sort of more comfortable mask. I can tell you like N95s are really uncomfortable, although they are the ones that prevent the highest, but that's more for in-hospital where there's high secretions and things like that. So you got to look at your comfort level. Just coming across kids that come through the hospital, a lot of them don't have a proper mask, right? They're trying to use the adult mask, or they're not cloth covers, which are pediatric oriented. So we need to make some effort with that, and hope that this COVID doesn't come back so we can get off the mask. I don't know what else to say.
The other thing added to what you mentioned, Noah, is the breaks. I don't know if they're considering in the schools breaking up the sessions so that it isn't a constant sitting at your desk for a extended period of time. Maybe the scheduling will be, and I'm only saying maybe because I don't know what they're thinking about doing, but maybe having sessions that have enough breaks in between so that, like you said, the kids can get up, the kids can maybe go to an outdoor area, they might be able to take the mask off. But I think that all of those concerns that are raised are what the DOE is looking at, and that's why it's kind of challenging to say, yes, we're going to open and we're going to go back to in-person classes, because all of that has to be figured out. And then the teachers will ultimately have that responsibility of monitoring. And I understand that that's even a concern for them. So these questions are being addressed, or hopefully they are being addressed. And I'm not sure that they have finalized answers to that as of yet. They do have some websites where they are selling more child size face masks that might fit better, and also looking at using ear savers as opposed to the masks going around your ears, because I know even for myself, it's challenging with those masks that you have to put the elastic around your ears. And then that might also be something to creatively involve your daughter in doing, because there's really simple ways to make these ear savers. You can make them with like pieces of elastic and buttons. So she might be interested in picking out the buttons. She might be interested in picking out the different colors of elastic that she can wear. So then she has some investment in what it is that she has to wear. I'm just, thinking of ways to get a buy-in from her. But yeah, wearing a mask for 6 hours is, I don't think anyone really does that except surgeons, and even transplant surgeons are not in the OR for 6 hours. But.
Right, and that's what they like to tell us, that, surgeons can do this, so why can't we? But, a 6-year-old is going to do other things with a mask. And, the concern is, for me, on her, scratching her nose, you know what I mean? And not even thinking. We do it as adults, right. But even more so as children, they have to go into the bathroom. They do all sorts of disgusting things in there. So that is my concern is, just not only just like getting a comfortable mask, but just like the mentality of a 6-year-old, a 4-year-old going into schools. We have to really consider that mentality and how far their brain has developed at that point to really even think about these issues. And there's but so much I can do at home to make her aware. Every time she comes in the house, she has to wash her hands. That's always been our thing. But when she goes to school, that doesn't connect. Right. So that is my concern. And I wish that the medical field was maybe louder when it comes to the administration, in the sense of, listen, elementary children, you got to take a little step back and really have a conversation about, their frontal lobe development and what they're thinking and how they're processing this information once they get into school. Mm-hmm. So that's my concern.
And Tracy, I think also, like, I have a 5-year-old granddaughter, and I'm actually very impressed how she wears the mask. She feels very proud. And it's a very fancy mask which she ties around. But again, it's not for very long, right? Nobody can tolerate a mask for a prolonged period of time. The other thing of any comfort it is that really, children are not the ones who spread the infection. Mostly it is the children get it from adults, right? It's the other way around. A lot of it is also has got to do with protecting the school people, like the teachers and the aides and health. So they are actually at high risk, just like us who are in the hospital. So they want to protect them as well. That's why they kind of insist that we should try to take as much precautions as we can, right? But this is not an issue that is easy to deal with. All we can say, the AAP does recommend that your approach should be different based on the age of the child and the class of, like the elementary are the least risky people, and the risk keeps going up by the time you get to teenage and adult years, where it's even more, you need to enforce it a lot more than in a primary elementary school kind of setting.
Mm-hmm. How many kids are in her class, or normally would be in her class?
I think about 25. I don't think it's 30. Mm-hmm. Mm-hmm. Yeah, and she has like an IEP and some services, so I would like her to be in person, but I'm not willing to risk her health for that. But that's really helpful to know that it's more children aren't spreading it per se. For example, like her grandmother had it, and we lived with our grandmother, and we were both like, she had a fever, and I lost the sense of smell, not taste. And grandma didn't do so good. Like she was hanging on there at home, and I don't want her to bring it home to grandma. And that is really my concern.
Mm-hmm. And that's a legitimate concern. It really is. So I think, there would need to be each case looked at individually, and see how they're going to even enforce social distancing in the classroom, as far as how far apart are the desks going to be. All of those things I think that they're probably working on at this particular time. I know my oldest daughter is an early education teacher, and they're beginning to start having conversations now. It's a private school, so it's a smaller setting, and they have more control over the decisions that they make, but they're definitely looking at how are they going to function and maintain the safety of the students, and as well as the safety of the teachers, as well as making sure that if the kids are safe at school, then they're less likely to bring anything home to parents or loved ones that may be at risk. So this is not an easy, this is a different, for lack of a better word, a beast that we've never seen before. So it's taken a lot of thought, and I do think that people are considering all of that and trying to make sure that they address the concerns of everyone, and make sure that everyone feels that they're safe and that their children are going to be safe.
And I wanted to see if the doctors could follow up related to that as kids transition from environment to environment, so sort of home to school and then school to home. What would be protocols that you would suggest as far as just hand washing or helping a child kind of doff and don a mask in a safe way? As some of our other guests talked about, as they encounter family members or people in the school environment. And so you want to kind of reinitiate some of the hygiene maybe that you would go through. So what do you advise families and kids do as they transition environments?
I mean, we know for a fact that, of course, and Noah talked about wearing a mask is very important, but hand washing as well. You can't say enough, or you cannot do enough hand washing, and not just your few minutes of hand washing. It's got to be extensive. Some people say sing, the ABCs, sing your happy birthday song, but make sure that you are washing your hands. So someone, say for example, coming home from school, one of the first things that they should do is wash their hands. If possible, even, I go as far as washing my hands before I even take my mask off, okay? Because you definitely don't want to be touching your face. And, making sure that you're washing your hands thoroughly, making sure everyone else is washing their hands thoroughly is very, very important. I don't know if the student would be traveling on public transportation, but you would want to encourage, depending on the age that they are, their understanding of even social distancing on the buses. I actually don't take the bus, so I don't know. I do see that they're letting people come in the back and how you're exiting the bus, but you want to adhere to those sort of procedures as well, to make sure that you are not putting yourself at risk and again, not bringing home anything to anyone at home. So if the student is traveling on a bus or any type of public transportation, they should really adhere to making sure they have their mask on and making sure it's over their nose, because I do see a lot of people walking around with the mask covering their mouth, but not covering their nose. So it needs to be worn properly, and they should maintain social distancing if they're on a public mode of transportation. And as I said, when you get home, you want to make sure that you wash your hands very well before removing your mask. And there's different takes on how you maintain a mask. I think the ones that you can wash, it would probably be a good idea to wash them. Some people don't recommend washing them every single day, but I think if you're going to go to school and you're going to be out in public and you're going to be on public transportation, I would say you should probably wash that mask when you bring it home, and have another one available that's clean and fresh to put on for the next day. And that, to me, should be really what everybody who is out and about is doing. You don't necessarily do those with the mask that we wear in the hospital unless it becomes soiled, then you throw it away and you get a new one. But these cloth masks, I think you should really maintain them by washing them daily, especially if you're going to be in contact with a lot of other people out of doors. So those are the things that I would recommend, especially if you're going to be traveling to and from via public transportation. I don't know if you have anything to add.
I would say that the first thing you do when you come home is just take a shower. That's what a lot of us do. We just run to the shower as soon as we get home, take off all the clothes, put them in the washer, wash away, and then start anew, But hand washing at every step, I can't overemphasize. I think next to the mask, that is the number one thing that people have shown that makes a difference,
Hi, this is Kayleen Contini. I'm actually part of the marketing team at NYP, so it's nice to meet everyone. I actually have another meeting, but I can stay for 2 minutes because I had a question. I have a 2-year-old actually, and we have to start putting her back in. It's a family daycare. It's only a few people, but of course, I'm nervous. So I just heard that like the percentage of kids exposed to COVID like it's very small, the percentage that get it or get the multi, MISC, and that elementary school is even lower, and she's only 2. But I guess I have 2 questions. Do we have any percentages, or do we know it's like, oh, it's less than, 1%? And then my second question is, I think I know the answer, but I've heard like, even if she doesn't have symptoms, she may still have it and could spread it, right?
Yeah, I mean, there is data on every one of those questions you have, which is updated on a regular basis. But the take-home point is just that, what you mentioned, right? Which is that the younger the kid, the less likely they are going to be sicker. Initially, the Chinese studies said that there was some higher risk if you're less than 1 year old. But that is still kind of being said, but the numbers are so small, we don't know what to make of it. But the risk of COVID and the severity of what happens when you acquire COVID goes up with age, right? So if you look at 2 to 5 is lower than the 5 to 10, which is lower than the 10 to 15 and so on.
Okay.
We haven't seen any MISC whatsoever in that young age group. We have most of the MISC we saw were school age or teens, right? I mean, we only saw 6 in our hospital, but still. Yeah, I mean, that's the fact. That doesn't guarantee. I mean, the last time I checked, the total number of deaths from COVID attributed to COVID in children was like 3 in the whole country. So it's pretty rare. It comes under less than 1%. The people getting COVID of the whole population is around 2%. Most recently, CDC says it could be as high as 7% because so many of them are asymptomatic. Now, if you test those kids, they're finding more of them. So it may be a little bit, but still it's, it's less than 10% of the entire COVID population that is in the country. So yeah, while there's no guarantee about anything, you could take some respite that it's not that likely. And if they have it, they're not likely to get that sick anyways.
Great, thank you.
Yeah, I mean, as far as, the multi-system inflammatory syndrome, like Noah said, it's really been seen more in your young adults. And I was looking at the stats last night for New York State. In total, there's only been about 237 cases and only 2 deaths in that amount. And kids are usually between the ages of like 5 and 9 or even 10 and 14 is where you saw the bulk of cases with that particular syndrome. So it is definitely something to be on the lookout for, but it has not been that significant of a illness to cause, deaths. I mean, 2 deaths is significant regardless, because that's 2 deaths but for someone, but it's really not been as bad as it could have been. So I think that, your daughter should be okay as well.
Thank you so much. I appreciate it.
You're welcome.
All right. Have a good rest of your day. Sorry I have to leave early.
Thank you. Thank you for joining us, and thank you for your questions.
Doctor, I have a question for you that came in on our form response. This is Mike from Borough Hall.
Yeah.
It is, does a fever necessarily mean that a child has coronavirus? And then I think the follow-up to that is, what do I do if I suspect my child of having coronavirus?
So the first question, fever could be for many, many reasons, and coronavirus is one of them. And in our setting now, at least you have to think about coronavirus as a good possibility. Would it be always coronavirus? Absolutely not. on the other side, you could have a coronavirus with no fever as well. So it's kind of works. Although at some point, almost everybody who is, I would say, symptomatic with coronavirus probably will get a fever. But at the outset, when you're seeing them, they may not have a fever, but they could still be having the virus. So that's one. So what we do recommend is if they have a fever, at this point, give it a thought, see if there's any other symptoms and see how they are doing. Prior to the test becoming universally available, we wouldn't even advise them to get a test. We'll say, give Tylenol, lots of fluids, stay home, stay safe, don't pass it on to your grandparents or anybody else, and so on. Now, because of so much availability of testing, I would say it's okay to get tested if there is some solace from gaining that information, because the test is, again, not 100% everything, that it'll give you every single answer, but because then you have to go into false negatives and all that kind of stuff. But there are situations where it's very helpful. So in that case, you would test them. If it's easily available, do it. Otherwise, just, stay home and give some Tylenol and make sure they don't get into any other complications related to coronavirus. Most kids with coronavirus that have been diagnosed with coronavirus do have fever, cough. Those that are a little older complain of headache and body aches. Those four are the most common symptoms, right? And most of them don't go beyond that. They all get that and they get better right from that. A very small percentage, particularly those which have an underlying chronic problem, like a pulmonary disease, heart disease, and such in children. We know about diabetes and hypertension in older people. But in children, these are the ones that they found. With asthma, is neither here nor there. Some say asthma is a risk, some say not a big risk. But anyhow, if you have any of those, then the severity is that much higher. But an otherwise healthy kid, usually it's just fever, cough, congestion, and they're out of it. Does that answer your question?
I would also,
Yeah.
I would just add that if those are symptoms, or the fever is a symptom that the child has, it is always a good idea to definitely touch base with your primary care provider.
Yeah.
And I know that was part of the reason for this series that we were doing today. You could still call your doctor and they would at that point be able to have some discussion, even if it's not visually through telemedicine, at least a conversation over the phone with you about the symptoms that your child is experiencing, because you also are going to want to know if there's been any exposure to anyone else who may have already been diagnosed or even tested positive for COVID. So really having a conversation with a healthcare provider around the topic of the symptoms is important, because more history would need to be gathered to then decide, do you say just observe and stay at home? Or do you say, well, maybe this is someone that needs to be seen? So I would also just add that you should call your doctor. And if you don't have a primary care doctor, most of the hospitals are accepting, telephone calls to their, to their emergency room, to their outpatient facility to help navigate and support parents around the whole pandemic and the symptoms that they may have and the questions that they may have about their children.
Excellent, Leslie. That is very important, as you said, because it depends on the age of the child, depends on exposure, depends on a bunch of other questions. So it's a good idea.
Another thing I wanted to see if the doctors could respond to is childhood vaccination rates and vaccination rates among adolescents. I know citywide this has been talked about, and the borough president has done some advocacy around trying to come up with creative ways to raise vaccination rates for these groups that, compared to last year at least, seem woefully low, some 50% levels. And so can you just speak about how you've been seeing that in your practices, and then how families and kids can return to what would need to be an in-person, although outpatient, activity related to these vaccinations, how they can safely do that, and what you've been seeing on those issues?
Yeah. So I can say for adolescents and I mean for general peds as well, the rates did go down, and that was expected because visits to outpatient facilities also went down. And you can't really give a vaccination through telemedicine. I know the CDC and the AAP, the American Academy of Pediatrics, and the Center for Disease Control recommended that up until the age of 2, you should still be doing well visits for those patients. So those patients were supposedly being seen and having their well visits and getting their vaccines, because ideally, most of the time, that's the age group where the bulk of vaccines are given anyway. So within my institution, they try to continue giving appointments to newborns and to patients who were under the age, well, I should say up to the age of 2 years, to make sure that they had their appointments and that they would come in and that they would get their well visits and they would get their vaccines on schedule as recommended. There was definitely an outreach to call parents. There was definitely an outreach to encourage them that we were maintaining social distancing, that we were not scheduling a lot of patients at one time, that they would be brought directly into rooms so that they would not be in waiting rooms waiting. So those are the things that we did to encourage parents to keep their appointments. Since I don't see young adults, I don't see young children, I do know that our numbers went down a bit, but we still did manage to see a fair number of patients under the age of 2 and give them their vaccines. For adolescents, which is more my age group, there are not a lot of vaccines that they are still required to get, except their meningitis, their second dose of their meningitis vaccine, which they get usually around the age of 16. So for those patients, I was making sure, as well as my other colleagues, that they also were called and reminded that they needed to come in for that vaccine. Now, mind you, teenagers don't like to come for vaccines anyway, so if it was pandemic or not, it was a struggle to get them in, okay? But then there were other patients of mine who needed college forms completed, who needed forms done for various other activities, like many of them, once the pools opened, were being lifeguards and needed working papers. So I was able to schedule visits for them as well to bring them in. And pretty much the way all of the visits were scheduled, they would be screened initially through a telehealth visit to make sure that they weren't having other symptoms that would put them at, that would bring them into the hospital and put them at risk of spreading anything to anyone else. And if they were cleared, then they were also scheduled for what we call an in-person live visit. The visit was scheduled, there was an ample amount of time between patients. Our waiting room was redesigned so that the chairs were separated at least 6 feet apart. Once the patient came into the facility, they were screened in the lobby, and a series of questions. Do you have fever? Do you have cough? Have you come in contact with anyone who has or may have been exposed to COVID? All of those screening questions were asked in the lobby prior to them being able to come upstairs. And they were also told when the appointment was given that they could only come with one other person. So these are the measures that we put in place and I know that a lot of other institutions did as well, to hopefully make parents and patients feel comfortable coming into an outpatient setting and being seen for their care. The vaccination rates are down, and the best that we can do at this particular time is continue to try to screen and make sure patients who are due for their vaccines are called and these appointments are scheduled. But pretty much the reason that the vaccination rate went down low is because they were not being seen. We were only seeing emergent visits at that particular time. So I don't know if that answered your question, but I hope I did.
No, that was excellent, because this is very similar to what we were doing, and I think the whole country was trying to do this, where people would refuse to come out. The children, I mean, in fact, this month's journal had an article on where have all the children gone, because nobody is seen near the vicinity of a hospital anymore. And of course, they are also pretty reluctant to go to even, the private clinics and so on, because they're worried that they'll pick up something. So that has been a big issue, but it looks like it's turning around of late between all the campaigns and all the press and all the efforts that the healthcare teams are making, as she said, as Dr. Hayes said, calling them, assuring them that we are clean, we are safe, we are really, staggering the appointments and so on. So some people have begun to come back. The fear, of course, is that by November, if we have an outbreak of measles or something, that would be a major disaster. And that's what, and then also we worry that when influenza season starts, and if COVID were to come back, the combination may be pretty deadly. So for all those reasons, we are pushing for immunizations. I guess the only other thing we could do is actually have a mobile van and go home to home and give them. I guess we are not there yet. If it was like really very low, I think probably people would have even considered that. But for now, I think with whatever efforts, it's bouncing back, and hopefully it'll return back to normal.
Yeah.
I have another question for you guys from the form. If a child is in a house with an adult who is infected with the coronavirus, should the child be tested before going back to school, or should they quarantine?
You want me to answer that?
Well,
So first thing is, I mean, this would be considered a child exposed to coronavirus, right? So once you're exposed to coronavirus, it's a good idea to test the child. Certainly 100% test a child if he has any symptoms, including fever. And then make a decision on that. We certainly recommend separating, or when I say separating, you take all the regular precautions of decreasing exposure of the child. I've known like homes where if they can afford it, the person infected is in one corner of the house and the rest of them, are in another corner, and there's like very little, try to prevent common sense exposures, right? Including, leaving food at the door and things of that nature to decrease the chance of infecting others. But for the child, that would be the strategy. You would monitor the child for all the symptoms and get the child tested. And if the child is negative and is asymptomatic, I would say, I think right now we say they can go back to school.
And then I think the follow-up to that question is, what is the testing actually like for a kid?
So it is the same as the adults right now. So it's a nasopharyngeal. So there are two types of testing for coronavirus, right? One is to check for, there's a molecular test, which is done through a nasopharyngeal swab or a saliva or an oropharyngeal swab. Uncomfortable, you stick a little Q-tip type thing in the back of your nose. I had it done 3 times so far. It's not fun, let me tell you. But it's not horrible either, but it's very irritating and annoying. So you take that and send it to the lab. Based on what kind of lab you have, the turnaround time is anywhere between 2 days to even 10 days, depending on where you live and which lab is doing what. There's a recent controversy about one lab trying to giving wrong results. I don't know if anybody read about that. Some lab in Florida that they're looking at 65,000 samples that they may have done wrongly or something. So those are all those issues. But typically the test, you take the swab, there's a medium, you put it in it, and you give it to the lab, and they will tell you positive or negative. That's one, the molecular test. Then there's an antigen test. The antigen test is less available. That has a turnaround time of only 1 hour. It's like a point of care quick test, but those things are not widely available still. Apparently there's a wait list for up to 3 months even to get that machines, to obtain those kind of machines. And not to talk about all the reagents you need and the swabs you need and the storing media you need. So there's all these logistical issues. That's as far as picking up the virus itself. Then there's the antibody test, which is a blood test. That can come back in an hour to a day also. And that test just tells you whether you have been previously exposed to coronavirus or not. That's all it tells you. It doesn't tell you that you're immune. It doesn't tell you anything else. All it tells you is somewhere before you were exposed to coronavirus. So those are the tests that are available right now.
So just, as far as what you were saying, Noah, when you mentioned the Florida situation where they potentially have misread or misinterpreted the results, with the nasal pharyngeal testing, you always have to take into consideration how the test is done, how accurately the swab has gotten to the area where the organism is sitting, because that determines what your results will show. So there's always a potential possibility that you could have coronavirus in your nasal pharynx, but that when the test was done and how the test was done, they missed it. So there's all, and these are why, I know it's confusing to maybe lay people who don't really understand all the mythology behind testing. And I'm not saying that in a derogatory manner, but those are the reasons why, the tests sometimes are positive and sometimes they're not, and the person sometimes is symptomatic and sometimes they're not. There's all of these other factors that interplay in how the test results come out and why they come out a certain way, because there's all these other factors. How the test is done, was the sample properly collected, did they go to the right area? Those things all impact on how the results may or may not turn out. So I think that makes why for, like I said, the layman not understanding, because people feel, well, if you got a test, why isn't it accurate? Why? Well, we should be able to give you, the medical community should be able to give you an answer, and it should be definite. But there's all of these other issues that come into play with any testing that I don't think people, sometimes understand, and it can be confusing. Yeah.
Yeah, and then if you do it very early of coronavirus, you can actually test negative, even if you have it. Mm-hmm. And that's why we say that in the hospital setting, if somebody comes in looking like coronavirus with all the symptoms and looks classic, and they're negative, we test again, and quite often it turns out to be positive.
Mm-hmm. Yeah.
Thank you. Are
And
there any? Oh, go ahead, Nate. You have another question?
Oh, yeah. If there are other questions, sure. Maybe the doctors can speak to just preventative things that families and kids can do. I know the Borough President talks a lot about nutrition, and we've talked about hygiene and vaccinations. Any other things you advise your patients and families as far as just staying healthy and other things they can do along with trying to maintain if they have any pre-existing conditions, or if kids have asthma or these kind of things, to just add some protective factors. And then one other thing would be, as we're kind of in the midst of the summer and kids and families are doing more outdoor activities, any guidance? We talked about masks, other things to note as kids are sort of out and about, spending more time perhaps outside the home.
Well, I think as far as, if I start with the end of your question and move forward, being outside of the home and more activities outside, you still need to maintain those key social distancing rules. We know for a fact that has been shown to help decrease the spread of the coronavirus. So even if you are out of doors, you still need to be wearing your mask. You still need to be maintaining distance. Now, of course, they're saying if you are from one family, you don't have to maintain 6 feet between the two of you. But if you're out and about in a park and there are other families out in a park, which I'm assuming they would be, there should be a 6 feet distance between you and that other family. And of course, making sure you are wearing your mask when you are outside, and the same sort of thing of washing your hands, making sure, you cleanse yourself well when you come in the house. Those are the mainstay of what will help to decrease the spread of this virus. And I don't think it is going to change, even though, the city and the state is opening up more. Those are key things that still need to be maintained because they have definitely shown to be effective in decreasing the transmission of SARS-CoV-2. As far as other things, you mentioned good nutrition, the whole social distancing, wearing your mask, washing your hands. I would also add to that the psychological aspect of the health. Being that we've been sheltering in place for so many months, it is still important to try to maintain some sort of normalcy, the routines that you've always had in your family. You want to try to maintain those routines if possible. I know it's hard. I don't have teenagers, I have young adults, but trying to keep them on a schedule that they're not staying in the bed all day. You want to maintain some of the same sort of schedules and routines that you maintain when we were not in the pandemic, as hard as that might be. And doing family activities together, and also sitting down and specifically talking with your children, with your adolescents, with your young adults about the whole pandemic. How is it affecting them? I know that sometimes adults don't necessarily think that that's a good idea to have that conversation, but it's an important conversation to have. Kids are concerned. I mean, we as adults are concerned, but so we know that our kids, even young kids, are concerned about what's going on. They may have even experienced someone dying from COVID. So you should have a conversation. So I think it's important for the mental aspect of the health to be addressed as well, and to dialogue with in a family setting or in a group setting about this pandemic and how is it affecting them and how do they feel about it. And they may say to you, I think so-and-so might die, I'm scared. And the response would be, yeah, I understand how you feel, and we're gonna try to get through this together, and we're all pretty scared, but I think it'll be okay. These are conversations that I think you should be having with your family and with your loved ones. So in addition to nutrition and maintaining good health and maintaining social distancing and washing your hands and wearing your mask, there definitely needs to be discussion about what's going on in the world and what's going on with this pandemic and how people are feeling, how your loved ones are feeling, how your family members are feeling, how you yourself are feeling at this particular time, because it's essential. It's very essential. But we have seen a lot of increase in depression, increase in suicides around this whole pandemic. So conversations need to be had. And of course, if there's something that comes up that an adult or a parent feels that it's a little beyond them to handle, then you should bring it to a health provider to see if there's a need for some other services to be given to the patient to help them with whatever it is that they're dealing with.
Again, very good. That was comprehensive and better than anything I read. The thing is, like, the one thing to remember, right? There is no treatment for coronavirus. There's no recommended therapy. The only thing we got is prevention. In addition to what Leslie said, it is also a civic duty that if you suspect you have coronavirus, stay home. Don't come out and go to the grocery store and everywhere and give yourself that risk to spread it to the community. And those would be like the important things.
Great. Thank you, doctors.
Thank you. I've learned a lot.
Yeah. And
Stephen, did you have any questions?
yeah.
So I've been wondering what you all think as peds doctors about me having, I've been thinking about having like mock school days with masks and social distancing, like for a few hours at a time, like here in the house. Because I might have to go back. I'm Stephan. I'm from New York Presbyterian, Brooklyn. I work in community affairs. And so I might have to end up going back to campus at some point. And my wife is an essential worker. She works in homeless shelters in social services. So we might end up on that, the rubric, that kind of draft about like group A, group B. Some people might be going back to school however many days. So we may end up in that spot. So like, will that do any good? Is that just spinning my wheels? I mean, he's been around. We had a Zoom wedding and he was really great about, and these were his best friends he hadn't seen in 6 months. He kept his mask on. He broke rules about touching people, but for the most part, it was kicks and elbows. But what do you think about like my silly dress rehearsals I'm planning?
I feel like children actually do much better than us. Once they get a concept, they'll be like, they want to do even better than what we can do, really.
He's actually, he's
I guess they're
arguing
less of a
with me
cheaters
about
than us. Yeah, I think mock anything is a good idea. It familiarizes them with what to do and go through the motions. And if they have any questions that they come up with, you can answer them. And you sort of make it like a game, like a fun activity. And it's not alien when we actually have to do it at school. This is like, they probably will teach the teacher, like, this is how you do it, So I am totally for it.
Great, thanks. He's actually trying to rebut. Yeah, thanks. He's trying to rebut that he didn't touch anybody. You heard the question.
But you said he did well otherwise, so
he did. He kept his mask on, and we were out in that park for hours.
That's very good. So Steve, hopefully he got a good reward for that.
Yeah.
That's important. You got to reward the good behavior.
It's true.
Are there any other questions to be asked?
I still want to go to wherever Tracy is.
I
actually have a
doctor. Go ahead, Tracy.
Funny enough, Barbados is one of the few places that are letting people in and experimenting with that. But my follow-up is I recently ordered a mask that also covers the eyes. Does that help?
For
her.
Yeah. It's a tricky question in the sense that one of the ways coronavirus is known to spread is contact with their eyes. So at least for healthcare workers, we recommend that they must cover their eyes with goggles, shields, or whatever, things of that nature. I'm not so sure how much of that would have to be done in the community setting, where the exposure with that high amount of droplet that gets into your eye is that much of a risk that you have to put goggles all the time, you know. It's not been recommended as yet, at least by CDC and the others, for in community use. But among healthcare workers or any high risk situations, we certainly recommend something to cover your eyes. And that's why I'm not so actually haven't studied this anywhere, but to me, these face shields are probably a good idea because they cover your eyes, they cover your nose, they cover your mouth, and you actually can see them, which is something I'm yearning to do. You know, I can't see people anymore.
It's not a bad thing for some people like me who show their emotions through everything I do with my face. So it's been a good thing for me. I can hide.
That's true.
I agree with that.
That would be me.
Same for me.
Well, I have to say, I mean, even though we had a small group here, I think I've learned quite a bit. You know, I'm actually thinking it would be great if our office can find, and Nate, maybe we can look into this, if our office can find some people who have the availability to maybe do masks for children. I like the face shield for children because face shields are much easier and they can keep that band on the head all day rather than having the mask. So maybe that's something, Nate, we could look into, especially maybe talking to Evan and some of our small businesses that are doing PPE.
Sure. Yep.
And I get it, you know, I get what Tracy's saying, you know, it's that 4, 5, 6-year-olds, they're not going to sit with a mask for 6. It's tough. I can barely do it. So, you know, but my attention span is a little low. So it's tough. It is tough. I don't know. Doctors, do you have any last minute words of wisdom that you can give everyone? And you know, I just want to thank you both for your time. It's been amazing. This is our first session, and to me, it was just great. So thank you both.
Yeah. My only thing is that you know, I'm also the president of Brooklyn Pediatric Society, so I kind of read up on what AAP keeps saying. And the new controversy, of course, was the AAP strongly came in recommending that in-person school is what we should be aiming to do for children across the country. And that was interpreted as, you know, how dare they do that? Within physician community, there has been a lot of opposition to that thought, like, you're going to kill all our grandparents, you're going to do this, you're going to do that, you know, all that kind of stuff. But the recommendation actually didn't say everybody must have in-person school. They said, based on your local situation, based on what is available in your community, the type of school, you can't have a 8 by 10 square foot classroom and do 3 feet distancing or 6 feet distancing, right? It's like some elevators that I get into, right? There's like no space, you know, it's like you cannot, it's not even 6 feet from one end to another. So, so you have to be practical about these things. And then based on that, you decide what is best for your community. In principle, we are saying that in-person school benefits children much more so than remote school. And there are many reasons for that. Anything from just better education attainment to, you know, access to school lunches and just the camaraderie between students and, you know, and there's a long list of things that they put out. And basically, I was convinced personally that it's probably better, but after assessing what is best for your community, in your school, in your setup.
Yeah, I would agree with you, Noah, as far as it has to be based on, it has to be individually looked at. Because even though the recommendation or the recommendation, for lack of a better word, was to go to telehealth, okay, and telemedicine. We know for a fact that in certain communities, that was not effective. Okay. And I think that when we also, talk about, and I'm an advocate of hand washing and the importance of hand washing, but having had an opportunity to, be on panels with individuals from other cities and other states, things were brought up around the health disparities and how they have not necessarily been addressed during COVID. For example, not everyone has access to running water. Not everyone can wash their hands. And I know in Atlanta, and this was from hearing this discussion from the president of the American Medical Association, Dr. Harris, they were going around to the homeless people who were in the street with water tanks to allow them to wash. So I get it that they're saying, school is important, and it definitely is. It definitely is, and it's an integral part of child development. We also need to recognize that every single school doesn't have the same setup. And I know that parents who have their children in schools where there are 30 people in a classroom, they're not, for lack of a better word, feeling this in-person sort of mandate or recommendation, I should say. And then these are a lot of the same people whose children will then come home to environments where there are a lot of people in the home, including grandma, including grandpa. They don't have the luxury of multiple rooms where everybody can spread out and live, in separate areas. So we really have to take all of it in consideration. And it's hard to do because it's almost looking at every single situation separately and developing recommendations based on separate areas. But I think that's what's going to need to be done. Because if we make certain statements or make certain recommendations on a global basis, it's not going to necessarily do well for some communities as it has done, or as it would do for other communities. So, like you said, and I think the AAP said that it has to be looked at in an individual manner, and hopefully even the DOE here in New York is considering that, because it's going to be different for different populations, different districts, different schools. It's not a cookie cutter process. Yeah. And a lot of these kids are going to be in communities where COVID was devastating to those communities. We really have to take that into consideration. But on a lighter note, with the mask that you mentioned, Ms. Lewis, I think they should design them so that, like, for the girls, they have like tiaras and things like that, and for the boys, different superheroes. And that's wrong. That's wrong. Let me backtrack, because if my daughters would hear me, they would be on my case. The boys can wear the tiaras if they want to as well, and the girls can wear the superhero stuff, whatever. But I think that would really be attractive, and I think that's something that we
make them fun.
And that's really something. There are two groups that we do know of in the Navy Yard who are making face shields. So this might be something that we get them to do. And I do agree with you. I think they should be really colorful and fun. And because you know what? As people talk to their kids, and I can only imagine trying to tell a 4-year-old, you got to go to school, you got to wash your hands, you can't touch your friend, you can't hug your friend, you can't hug your teacher. We're scaring them. Mm-hmm. We're scaring them. And so, if you can maybe say, okay, as long as you wear this, you're going to be a superhero of the day, you'll get through it, I think that would help. So we'll definitely take that as an aside to take back to the BP. But thank you both very, very much. And thank all of you who attended. Glenda, you have any last parting words?
No, I just want to thank everyone. Stephen, did you have something that you wanted to share?
Is there data on the shields? We talked about the shields, but is the data as strong on the shields as it is on the mask, or have there not been the level of reporting?
I actually didn't come across shields used in the community as a data point. There's a lot of talk of shields in the healthcare environment, but
Yeah.
in the community people using, I haven't seen any data on that. Having said that, I see tons of people wearing shields on the streets now.
Yeah. So the
So
shield
it is already in
effectiveness.
there. You know, my parking attendant at our hospital is always in a shield.
Yeah.
For example, you know.
And sometimes in the hospital, don't you see the people with the shields and a mask? Like they wear masks?
Yeah, you could do both. I mean, for
Yeah.
us, you know, we say do whatever you want to do to protect yourself,
Yeah.
because we deal with high risk. You know, we are dealing with secretions of patients all the time, so we have to do all that. But
the data
yeah,
is the data there for the shields the way
I
it is
can
for the
say I
masks?
haven't seen that data.
Okay.
But
Me neither.
specifically, I have to look at it, but I don't think it's there.
Mm-hmm. Yeah.
One other quick note before we close, and I want to thank everybody as well, Lori, Glenda, and the whole team, and the doctors. But one other note that has been in the news in recent weeks is the reopening of childcare centers. So I know the mayor has talked about this as well, and I don't know if you have any comments or closing thoughts on that as that gets restarted. I know there's different protocols with that. But for parents and families who may be sending their kids to these environments, along with observing the guidance for those things to keep in mind.
I would say it's pretty similar to school, probably minus the masks for the younger ones, right? We don't advocate masks for less than 2, neither does CDC. So minus the mask, all the other things apply, the social distancing, the hand washing of the staff particularly, and being very hygienic about all the processes during feeds and cleaning the kids and so on. I've seen one of my colleague pediatricians, her daycare actually had made like almost these plexiglass boxes, and they're putting them in there to eat. And it's like, and she wasn't very thrilled, and she's a pediatrician. She's like, "What are you doing, putting my kid in a box?" But you know, it's kind of, yeah, people have to be innovative to see how we're gonna try to prevent, you know, cross infection between these kids.
Yeah.
I don't know, Leslie. I don't know. Yeah.
No, I agree with you. I mean, as I hear, you know, the questions and some of the solutions, like you're talking about with the plexiglass box, I'm so happy I don't have kids, because I don't know what I would do. You know, it's disturbing because you do wonder, am I putting my child at risk? What's going to happen? So you're trying to work, and you know, in the regular life when we didn't have COVID, it was challenging to work and be concerned about your kid. Now it's even more, because you're worried about the risks that they may potentially be placed in by going back into those environments. But I agree with you. The same sort of the social distancing, the good hand washing, all of that is really important, even in the childcare environment. And you know, I just shake my head because I feel so sorry for even those workers, because they're probably anxious about making sure they don't pass anything to these young kids, and all of that, in addition to trying to just take care of them. It's really just, it's a lot. But no, I agree with what you said so far, as I don't know if anything else that I would add to that.
And of course, you know, you do your temperature. I mean, you have more reasons not to let the kids come into the daycare. If you're sick, they're not letting you in. They also can let in the same number of kids. Obviously, it's probably going to be 50% of capacity. So you probably run out of daycares pretty fast, actually, which would be another problem. But
it's going to be interesting down the line, you know, and I think, Noah, this is probably not even a conversation to have at this point, but the immune systems of these kids, how they're going to develop now that they're less and less exposed, you know, with all the hand washing and the hand sanitizer and everybody covered off. it's going to be really interesting to see the development of their immune systems down the line. It's going to be a nice study to do. Yeah.
I think
Sorry, I'm talking other business at this point.
No, I'm a product of all that hand washing and craziness, and your immune system definitely takes a hit when you're older in age. I definitely didn't have, you know, all these allergies and stuff because I wasn't allowed to like lick the floor. So it just is what it is now. Now I have to deal with all the nonsense. So yeah, they're probably gonna have like immune systems that didn't get challenged enough. Yeah.
Absolutely.
Wow.
Interesting.
Well, everyone, I think we have reached a closing to today's session. So I just want to first and foremost thank Dr. Hayes and Dr. Kondamudi for joining us. Thank you for all the insightful and helpful information. I'm sure, although many couldn't join us as we would have anticipated, we have again recorded this session, and I'm sure we will share it with those who couldn't in the future. So thank you everyone for joining and all of your questions, and we hope to be in touch for a next time. Thank you.
Thank you for the opportunity, and you did a great job as our moderator, both of you.
I'm very pleased. Thank you so much.
Thank you.
Next time.
Everyone, be well and keep safe.
Be safe, everyone.
Thank
Take
you.
care.
Bye.
All right.
Bye. Take care.
Bye.
Thanks all.